Today, Denver is in the top 20, not on a list that you want to be in the top 24. Right now, IQ Air rates the city air quality as the 17th worst in the world. The air quality index is hovering around 100, either moderate or unhealthy for sensitive groups. Never good. Our 9 News health expert, Dr. Payal Kohli, is here to help us understand what the air quality index means and how it affects our health. Should we check this, and how do we even check it, and what the heck is it, air quality index?
I'm so glad you know the air quality index for today, because you should be checking it every single day. So just like Kathy tells you the weather, she also tells you the air quality, and it's a weather forecast for your lungs, so to speak. So, you know, this is something I wasn't aware of, but I thought it was a single pollutant measurement. But it's not a single pollutant. It's actually a summation score that represents all the pollutants out there. And so the composition of the air quality index can sometimes change. There's really 2 main things we're looking at: that PM 2.5, which is particulate matter that comes from wildfires, and then ground level ozone. That's your summer smog. And so which one is driving it can be very different. And we know that right now it's particulate matter 2.5. So I don't check it all day long unless I expect it to change because the wildfire pattern is changing or what have you. But I listen very carefully to the morning show meteorologist. Usually it's Katie, who tells me what's causing it, what's driving it, what's expected to happen.
Wow. Okay.
As a cardiologist, who are you most concerned about? Like Kim mentioned, sensitive groups. Who is that? Who should be most concerned?
So, you know, the no-brainer for sensitive groups is, of course, heart patients, lung patients. We all know that. Anyone who's older, so older than 60 or 65, you're considered a sensitive group. Anyone who's younger. So kids, I had my niece and nephew visiting last week, and I'd been checking the air quality index every day, because if you take kids to the playground when the air quality is bad, that's not a good idea. And then pregnant women, that's the other one that's considered a sensitive group. Anyone who spends more time outside. And guys, it's not just about the index, but it's also about your exposure to the index. So let's say summer smog is driving it, and that's kind of our, you know, car pollution, our industrial factories, and you live in Commerce City. Your local AQI, because you live close to a factory, close to a highway, may be higher than someone somewhere else. So I really sort of think of it as one of the best things that we can do for our lungs, because the World Health Organization says is one of the most avoidable causes of cardiovascular death. And in fact, it drives 12% of deaths worldwide, is bad pollution.
That's scary.
Yeah.
You know, but Mark Salinger yesterday was talking about he had a headache, and he said, I feel like it's a wildfire smoke. He's been covering a lot of the things.
Yeah.
What can you do, though, if you're doing your job and you have to be outside?
So the first thing is you have to know the numbers so you know the risk. And so AQI, the higher it is, the worse it is, okay? So 0 to 50 is good. 50 to 100, those sensitive groups we talked about should minimize time outdoors. 100 to 150, the sensitive group shouldn't go outdoors, shouldn't exercise outdoors, shouldn't really do a lot of activities. And then over 150, all of us, even the healthy people, should limit their time outdoors. So you know how we say when it's hot outside, exercise in the early morning or late in the afternoon? That's not how it is with AQI. You actually have to look at the AQI forecast to know when to exercise, if at all. I'm putting my car on recirculate when I get in there, because you don't want to drain a lot of that fresh air.
That's a good idea.
In there.
Didn't think of that.
Yep, running the air conditioner at home. And then I bought a HEPA filter too, because I saw the AQI forecast this week, and so I went and bought myself a HEPA filter. But that's particularly important for sensitive groups if you have kids at home, or of course a pregnant wife.
Does elevation play a role? I mean, we live at this elevation, so is everything relative, or does it play a role?
No, it absolutely plays a role, because even the way that the environmental exposure and the patterns happen is different from different elevations, and the amount of ozone that we have here in Colorado can also be different. And we know that in the summer when it's hot, we can get a combination of both the particulate matter and the ozone, which is really a double whammy. And these are things I wish we had a sensor that we could wear on our watch that would tell us exactly how much exposure we're getting. But I think if we were more aware of it, we would realize it. And it could look like a beautiful day outside. Today it's hazy, so it's easy to tell, but it could look beautiful, and you could still have a bad AQI. So I want us to start thinking of this almost like, you know, in medicine we say the 5th vital sign, but here this is one of the things you work into your routine every single morning. You check the weather, you check the traffic, you check the AQI.
Another reason not to get up and run outside. But that's just me.
Kim was just looking for another reason.
She could run inside with the HEPA filter and the air conditioner.
Who wants to run in the morning? Anyway, Dr. Kohli, thank you.